Are you a nurse practitioner thinking about doing hospice care? Well, in this video, I'll explain to you the roles and positions of a hospice care nurse practitioner, what you'd need to expect, pay ranges, and everything else in the middle. Let's get started. Hi, I'm Dr. Priscilla Davis. I am a double board certified family and psychiatric nurse practitioner, and today we're going to talk about hospice. I did hospice care as a nurse practitioner for 2 years, and at first, before I started, I was a bit hesitant. It was kind of offered to me in a sense of, hey, you know, come do this interview, see if you like it, and we'll go from there. And I ended up doing the interview. I talked with a medical director, and it just happened to be something that I just felt led to do it. And it just, God was, you know, talking to me almost. It was just like very peaceful and just a welcoming environment. And honestly, I worked in a um, interesting environment, as to say the least. And they were going through change of management, if you know what that means. And the team that I work with was phenomenal, and the patients, always a pleasure to serve my patients, but they have a special place in my heart. However, it just was an interesting time because I know it's not for everybody, and I believe that nursing is a calling. And at the end of the day, it felt like it was a calling in a sense. And one of the families that I helped served and, talked about hospice. And the role kind of changed in the middle of the job, which, I didn't really appreciate and I didn't understand in the beginning. And towards the end, you were kind of teaching people about what hospice is, and they incorporated palliative care, which I ended up doing two jobs in one, and that was just way too much. But a family that I connected with was in palliative care range, and it's the middle of nowhere. You're driving up, it's the country, and you're just like, oh gosh, I'm either gonna get cussed out. We're gonna get cussed out. They knew I was coming. So, or it's about to be really weird. It ended up being the most beautiful experience I have ever had, or one of the most beautiful experiences, besides actually watching children being born. And that's, uh, I don't know, there's nothing that can ever take that away. Watching children being born, that just gives me chills and tears all at one time. But let me not segue from that. But it's just the most beautiful souls and um, faithful people of God. And I just, you know, when you walk into a situation, I try not to make any assumptions, but, um, you're rolling up and you're just like, oh, okay, we're going to see how this goes. But God, you got me right. And I walk in and I see a patient in need and their family member, and they desperately need hospice services, but they're hanging on to life. Um, and I can't make that decision for them. I'm just here to say, here are your two options. In my professional recommendation, I think you would thrive with hospice, but I'm not, I'm not gonna bore you, or I'm not gonna, you know, push my demands on you. And I don't do that because I don't like people doing that to me. People know when it's their time to make a certain decision, and it's their moment. So you need to be able to, as a hospice nurse practitioner, be able to have that conversation, because even sometimes the patient is ready, but the family is not, or the spouse is not, caregiver is not. And you need to be able to have that, be the patient advocate, but also understand that your time is not their time, and their time and God's time is all different time. And so, so just be cognizant of that when you're walking into a situation like this. And of course, you'll have people, people are in their feelings, and it's that time um, where emotions are high, and not everyone quite understands what it's supposed to be like. And even you don't know what it's going to be like. But after watching and helping many families go through that situation, I can honestly say that um, it's definitely a spiritually rewarding calling. And it was more than a job because the pay was okay. It wasn't bad, but it was okay. And so this is my second. Let's just segue into that. Knowing that it's going to be emotionally taxing, and knowing that the type of person that you are. And I even had like my family was like, "Are you going to be okay with this?" And surprisingly, I was okay with it. Um, and then I was just overwhelmed with the different changes of the company. But I mean, that's just like anywhere. But my team was great. Patients were always perfect. I mean, I think patients are beautiful souls, and it's just yes. And going into that, I didn't have that going in, so I just kept an open mind, especially when I decided to take the offer. I kept an open mind, and it was really what kind of really kept me going was the patients towards the end there, and the team, of course. If you have a great team, you can go through anything. So the second portion of it, of course, they had a full benefits package. Pay starting was about 110. They had a bonus structure, and it was depending on how many patients you saw, you got to have a certain amount of money on bonus. And I mean, I completely forgot how much it was. But then we also had call, and then we had rounding at the various care centers that were close to you. So you were on call, you were rounding, you got extra pay for that. It was like $300 to $500 depending on the night, day. I'm not sure because they changed it, and then I went part time. So um, I people were making a lot of money doing that, and then they added a palliative care component to it. And the palliative care, it was seeing certain amount of patients, and the certain amount of patients that you saw got um, a certain amount of uh, two patient was maybe like I think it was like 50 to $75 depending on the I think it was like $75 for follow up. Initial patient was like 200-ish. So it just depended how you did. But you I mean they're nurse practitioners out there, busting their butt. One thing that I would say caveat is a lot of these positions where you have to drive, you're on the road like a road warrior, and you just have to have a good economic car, and they pay for your fueling. Just know that the car that you're going to be driving, you're going to be doing this for more than 3 to 5 years. You're going to require to have a better car. But overall, it was a really good experience. Um, I'm not opposed to doing that again. However, I've kind of pivoted, and it kind of led me, honestly, to doing psych because you're dealing a lot with family emotions, and you're dealing with um, psychiatric conditions. You're dealing with bacterial infections, viral infections, so you are the provider for that patient at the end of life, and you're given a formulary, and within that formulary, you can operate. And of course, if something were to go down, they can go to the hospital if they wanted to, but um, at the end of the day, it's at the patient's discretion. So once you opted for the hospice benefit, you could stay at home and pass peacefully, or if you wanted to go to the hospital because it was something not related to your diagnosis, then you would decide to go to the hospital for that specific thing and then get discharged. And a lot of the ERs have hospice wings or hospice area where the hospice patient would just go in, and this is where they would go. They wouldn't have IVs done. It's actually it's a really, really good thing towards the end of life, especially for our older populations as well. But if you're looking for a hospice or palliative care position, it's definitely something if you're interested in doing. I think it's definitely a good a good option as a nurse practitioner. It gave me a lot of flexibility, and I really like that. I like flexibility, and it also gives you autonomy as well, and I love that too. So if y'all have any questions, please put them down in the comments below. If you have any comments, concerns, let me know. Like this video, subscribe. Thank you very much. Bye bye.